Welcome to the course on TMS Provider for Medical Superintendent, MEDCO, and PMAM. This course contains 8 topics. We are now in topic 7, Discharging a Patient. You need to be a medical superintendent, medical coordinator or MEDCO, or a Pradhan Mantri Arogya Mitra, also known as PMAM, to discharge a patient on the Transaction Management System or TMS provider application. You can initiate a patient's discharge after their treatment is done or when they want to leave the hospital or in case of death. By the end of this topic, you will be able to discharge a patient on the TMS Provider application. This is the TMS Provider login page. Let's start by logging in. For this training, we have logged in as a medical superintendent. Upon logging in, your dashboard and work list are displayed. Click the Under Treatment tile to initiate the discharge of a patient. The application displays the name of a patient who is currently undergoing treatment. Click the arrow icon for the patient whose treatment is complete and needs to be discharged. On clicking the icon, the patient's under treatment form opens. In this form, you will find 4 tabs, each containing treatment details of the patient, entered during pre-authorization. Now, click the Ready for Discharge button. Then, click the drop-down button in the Discharge Type field. The drop-down displays 4 options: Normal Discharge, LAMA, DAMA, and Death. You need to select Normal Discharge when the treatment of the patient is complete and the doctor has advised the patient to be discharged. Select LAMA or Leave Against Medical Advice when the patient has decided to leave the hospital against the doctor's advice. Select DAMA or Discharge Against Medical Advice when the patient has decided to get discharged from the hospital against the advice of their treating physicians. And select Death if the patient has passed away. Now, let us see the information that we need to enter when we select each of these discharge types. When you select LAMA, you will have to select the LAMA stage, the surgery date, and LAMA date. Then, you need to upload the patient's in-treatment photo with the doctor or PMAM and select whether the hospital provided the medicines during treatment or for post-operative care. Next, when you select LAMA, you will have to select the DAMA stage, the surgery date and discharge date. Then, you need to upload the patient's in-treatment photo with the doctor or PMAM and their Mangalkamna Patra and feedback form. When you select death, you will have to select the death stage and death date of the patient and upload their death certificate, clinical note or death summary, and mortality audit report. In this training, let us see what happens when you select normal discharge. After selecting normal discharge from the drop-down, click the Download Mangalkamna Patra button, and the document will get downloaded and get displayed in your downloaded files. The Mangalkamna Patra is a feedback form given to the beneficiaries to capture their feedback regarding the services offered under the Ayushman Bharat Pradhan Mantri Arogya Yojana. This document contains 2 pages. Give the second page of the document to the beneficiary so they can share their feedback. Please note that the discharge button is enabled only after you have downloaded the Mangalkamna Patra. In the discharge information section, you need to select the discharge stage of the patient. Then, enter the patient's surgery date and the patient's discharge date. Next, upload a post-surgery photo of the patient along with the doctor or PMAM and upload the patient's discharge summary report. Then, you need to upload the Mangalkamna feedback form filled in by the patient. Next, select Yes if the hospital provided medicines for the patient during treatment or postoperative care. For this training, we have selected No. Then, click the Save button to save the details. On clicking the button, the application displays a message that the discharge information is saved successfully. If required, you can edit the details entered by clicking the Edit button. Now, click the Discharge button, and the Verify Patient page opens. Here, you need to authenticate the patient using BioAuth methods. You can do the patient's authentication via fingerprint, iris scan, or Aadhaar OTP. When you select fingerprint, you will be required to authenticate the patient's fingerprint. When you select iris scan, you will be required to authenticate the patient's iris. You need an external device to authenticate the patient via their fingerprint and iris. And when you select the Aadhaar OTP, the patient will receive an OTP on the mobile number that is registered with their Aadhaar. The medical superintendent has an option to discharge a patient without Aadhaar authentication. For this training, we have selected the checkbox, Proceed without Aadhaar authentication. Upon selecting the checkbox, the Discharge Consent section opens. Upload the Medical Superintendent Declaration form and click the Save button. On clicking the button, the application displays a message that the discharge consent is saved successfully. Lastly, click the Discharge button, and the application displays a message that the patient has been discharged successfully. With this, you have come to the end of this training. You have now learned how to discharge a patient on the TMS Provider application.